Parastrongylus cantonensis. So your Parastrongylus cantonensis is previously classified under the genus Angiostrongylus, and it is commonly known as your rat lungworm because they normally live in the lungs of rat. And we humans are accidental hosts and they causes eosinophilic meningoencephalitis in mans. So this was first described as a parasite of the Norway rat or Rattus norvegicus and of the black rat in Guangzhou, formerly Canton, in People's Republic of China in 1933. And the first human case was reported from Taiwan in 1945. So your male adult worm, they are male and piliform, and they can go up to 16 millimeters to 19 millimeters in length, and its diameter is around 0.26 millimeters. They have a well-developed caudal bursa, and it is kidney-shaped and single lobe. So your female adult worm, they go up to 21 millimeters to 25 millimeters in length, and its diameter is 0.3 to 0.36 millimeters. The uterine tubules are wounded spirally around the intestine, thus giving them a barber's pole arrangement. Yung barber's pole arrangement is, di ba, ganito. So, they can lay up to 15,000 eggs daily, and the eggs are described as elongated ovoidal with hyaline shells. So, transmission, they are from contaminated vegetables and paratenic hosts such as freshwater, prawns, crabs, and frogs may also play a role in transmission. So, for humans, the transmission to humans is primarily by consumption of your raw snails. So, the life cycle is ito. So, yung rat, they play the role of definitive host. So, in the pulmonary arteries ng mga rats, andun yung mga adults, no? The male and female. Then, they mate, and then they will produce larva. And then, yung larva na yon, nagpe-penetrate sila sa circulation ng rats, and eventually, they reach the intestine only to be passed out in their feces. So, yung stage 1 larva na natain ng rat, they will be ingested by the gastropods. No, that's your snails or slugs. Then, sa body ng gastropod, yung stage 1 magiging stage 2, then stage 3. Then, pag yung slug or yung snail na yon ay nakain ng mga rat, yung stage 3 larva na yon ma-release sa body ng snail. Then, the stage 3 larva will ma-release sa body ng snail habang, di ba, kinain sila ng rats. So, yung stage 3 larva naman, pupunta doon sa brain ng rat, then magmamature ng male and female, then magpenetrate ng veins ng brain nila. And ayun, pag penetrate ng vein, masasali na sila circulation, and sometime, maabot na sila sa pulmonary artery, thus repeating the cycle. No? So, as humans, we are accidental hosts. So, accidental ingestion of mga prutas na merong contaminated, no, with slugs and snails, or kahit yung mga taong kinakain nila ang raw na snails or slugs, we will be getting the stage 3 larva. However, since we are accidental hosts, hindi naman magmamature ang stage 3 larva. But, katulad ng rat, yung stage 3 larva pupunta sa iyong brain, pero hindi naman sila magiging adults. Pero they will still cause significant manifestations in the brain. So, yung mga symptoms ng patient usually is nagadepend kung saang part ng brain, saang lobe siya, nandoon. So, ayan. So, your intermediate host, ito yung mga intermediate host na makikita sa Pilipinas. So first is your giant African snail or Achatina fulica, your Hemiplectus hagitifera, and your Helicostyla macrostoma, your Vaginilus plebeius, and your Vernicilla altae. So diagnosis will be examination of cells in your CSF. No, usually dami kang WBC doon. That's around 100 to 2,000 WBCs per UL. And pag may eosinophilia ka na greater than 10%. Then CT scan, merong mga lesion sa iyong meninges. Then serologic test, no? That's your ELISA. For treatment is usually supportive with the use of analgesics for pain and corticosteroids to limit the inflammatory reaction. So, when the physicians remove CSF, they do it at frequent intervals to relieve the headache in patients with elevated ICP. Then, there are no antihelminthic drugs that have been proven na effective in treatment. And there is a concern that antihelminthics could exacerbate neurological symptoms due to a systemic response to dying worms. So for the epidemiology in the Philippines, no, this parasite, Parastrongylus cantonensis, can be found in rats that were seen in the provinces of Luzon. It's in Batangas, Bulacan, Cavite, Ilocos Norte, Laguna, Mountain Province, Nueva Ecija, Pampanga, Pangasinan, Quezon, Rizal, Sorsogon, Tarlac, and Metro Manila. So thank you very much.